What is osteopenia, and how does it affect bone health? Osteopenia is a condition that indicates lower than normal bone mineral density. This means that bones are weaker than they should be but have not yet reached the level of osteoporosis. It is a stage of bone loss where the density is reduced enough to increase the risk of fractures. Yet, it does not meet the criteria for osteoporosis. Bone mineral density is measured using a dual-energy X-ray absorptiometry scan. This scan provides a T-score, which compares an individual's bone density to that of a healthy 30-year-old of the same sex and race. According to the World Health Organization, a T-score between -1 and -2.5 indicates osteopenia. A T-score below -2.5 is used to diagnose osteoporosis. Osteopenia affects bone health by reflecting a loss of calcium and other minerals in bone tissue. This leads to bones that are more fragile and at a higher risk for fractures. While osteopenia itself usually does not cause noticeable symptoms, it signals an increased risk of fractures, especially if the condition progresses to osteoporosis. Many individuals with osteopenia remain symptom-free until they experience a fracture, which often occurs in the spine, hip, or wrist. Clinically, osteopenia is significant because it can be a precursor to osteoporosis, a more severe condition characterized by significant bone weakening and a high risk of fractures. Regular monitoring of bone density through scans helps track any changes and guides preventive or therapeutic measures. Several risk factors can contribute to the development of osteopenia. Aging is a primary factor, as bone mass peaks around age 35 and begins to decline thereafter. Hormonal changes, particularly in postmenopausal women, certain medications, lifestyle factors like smoking or low physical activity, and underlying medical conditions that affect bone metabolism can also increase risk. Managing osteopenia involves several strategies. Lifestyle modifications are essential, including ensuring adequate intake of calcium and vitamin D, engaging in regular weight-bearing exercise, and avoiding smoking and excessive alcohol consumption. Periodic monitoring of bone density is important to detect any progression of the condition. Healthcare providers may use tools like the Fracture Risk Assessment tool to estimate a person's 10-year fracture probability by combining bone density with clinical risk factors. In some cases, medication may be considered if the risk of fractures is high, even if the criteria for osteoporosis are not met. In summary, osteopenia serves as an early warning sign of compromised bone strength that can lead to osteoporosis if not managed properly. It highlights the importance of taking proactive steps to maintain bone health and reduce the risk of fractures. Always consult with healthcare professionals for personalized advice and management strategies.